So, sticking overseas, coronavirus case numbers in Germany are soaring as the country records its highest infection rate to date. Health officials announced more than 15,000 new cases were reported over the past 24 hours. These numbers are raising alarms at some of the country's hospitals. At least 67% of the population is fully vaccinated, but many of the cases are among people who have not yet gotten the shot. So, CBS News reporter Anna Noryskiewicz joins us now to talk more about this from Berlin. Anna, this is really surprising to me because I always saw Germany as taking this virus very seriously, very early on, instituting lockdowns and restrictions pretty thoroughly. And now I'm hearing a phrase that we've heard often here in the U.S., that we are seeing a pandemic amongst the unvaccinated. Where does Germany stand when it comes to vaccines compared to the rest of Europe?
Hi, Anne-Marie. So the situation is serious, though it was predictable. As you just mentioned, only 67% in Germany of the German population is fully vaccinated, which means that 14 million people are not. And this is the problem now, that the majority of people who need treatment who are in ICU unit and ICU beds in German hospitals are not vaccinated. And the problem is that vaccines in Germany are not mandatory, and the corona vaccine also among healthcare workers is not mandatory. So it's still up to every individual to decide whether they want to get a coronavirus vaccine. And this is due to, very simply, Germany's history. Vaccines are not going to be, at this point, mandatory. And of course, the debates and discussions in Parliament are very loud about this, that at least healthcare workers should be it should be mandatory for healthcare workers to get vaccinated. Yeah. But compared to other European countries, Germany has still a very low vaccination rate, and this is the problem.
Okay, so low vaccination rate. What about other sort of COVID-related restrictions, or have all of those restrictions generally been lifted in Germany?
So the majority of places now, especially here in Berlin where I am, has the rule, restaurants, bars, cafes, has the rule to only let people in who are either fully vaccinated or who have recovered from the coronavirus. But that also means that people who are not vaccinated and want to participate in daily life would need to either prove that they are vaccinated or that they recovered from the virus. Now, a few weeks ago, the German government decided that those free COVID tests, the lateral flow tests that every citizen was able to conduct for free every day, they decided to close these testing centers, which, so to say, you could say that this is kind of trying through the back door to at least encourage people, the unvaccinated people, to get vaccinated. And also places, as I just said, restaurants, cinemas, and cafes are now implementing this rule of having only vaccinated or recovered people. The thing is with the German government that, of course, the main goal is to keep everything open, to not have another lockdown, to keep schools open, and this is why they're encouraging people to decide to get vaccinated.
Right. So, of course, we gauge the concern level when it comes to the virus based on how much can the healthcare system handle. So what is the situation at hospitals in Germany? Are they becoming overwhelmed, or is there a fear that they may be?
At this point, and throughout actually the whole coronavirus pandemic in Germany, the intensive care units in Germany were not overwhelmed. And at this point, this is still the case, but this is simply to good risk management and crisis management, where they're postponing surgeries, saying that we'll conduct the most urgent surgeries now, and what we can postpone, we postpone. So that's ICU beds are available for patients now. Of course, some politicians in various states in Germany say that people who are not vaccinated, who need treatment in an intensive care unit, should not be expecting that they will get treatment in their hometown, but they will have to be, if the situation gets very serious, they will have to be transferred to other parts of Germany. So far, in Germany, across the country, the situation is still manageable. But right now, politicians, and especially the new government, which is forming itself right now, in the phase of forming itself right now, is at this very moment, actually today, trying to work on new regulations and how to tackle especially winter, or autumn and winter now.
I want to get into that, but I will just ask you this. I mean, part of the conversation that we're having here now is about booster shots and who should be eligible and what should be considered fully vaccinated. Should it include 3 shots or just 2 shots? I suppose, I don't know, when it comes to health officials in Germany, have you even gotten to that conversation yet? Because there's so many people who still haven't received their initial vaccinations?
Exactly. We're not in Germany as far as in America now, because the debate is still focused on what are we going to do with the people who are unvaccinated. Of course, our health authorities and the health minister Jens Spahn has been very early telling his party and the people that booster shots should be made available for everyone who wants them. Now, of course, there are voices becoming louder saying we should first focus on people who are still very critical of getting their first shot. And if we start with the booster shots now, it should be given to the most vulnerable people. So also what's important to mention is the bureaucracy behind the whole vaccination plan in Germany and the vaccination program in Germany. As also CBS reported a few months ago about how it looked like, and how the system was inside these vaccination centers. If you compare it to the US, in the US you had a very simple and very straightforward system of people driving into parking lots, putting their arm out and getting a vaccine in their arm, a shot in their arm. This was not the case in Germany. In Germany, especially in the beginning, the bureaucratic process of making your way into a vaccination center, getting the first shots, having everything documented, and then the problem of actually physically having to fill out 10 to 12 forms was really the problem, and the reason why the whole process of getting vaccinated was so slow. Right now, the new government is blaming exactly that slow process and the bureaucracy for the slow vaccination rate, for the low vaccination rate, and this is going to be one of the first things that they will change.
I can see that making a big difference. I think I was in and out in 15 minutes, probably less, when I got my first shot, which made it, really easy to think about getting the second shot because I knew it wouldn't take that much time out of my day. Also, I wanted the vaccine, but if I had to fill out a bunch of pages, I can see people maybe putting that off. Anna, very good talking to you. Thank you.
Thank you.